Hey YouTube, here's another video. Maybe the last one. I don't know. I'll have to think about other topics. Maybe you can, if I'm missing something, you can, and you want to hear about it specifically a year post surgery. Let me know if I missed it, and I'll have a topic or maybe make a video or I guess even just address your question in the comments. But this is again 1 year post hiatal hernia and surgery and TIF, and a little over a year now. But this video, I guess, will be specifically on more so lifestyle and exercise types of stuff. Before, when I had the hernia, I really wasn't affected with exercise very much. I did what I wanted to do. I'm a weightlifter. I'm not a bodybuilder necessarily. I just do resistance training. But I'm not necessarily a bodybuilder. I just like resistance training, lifting weights. And I've just done it for a great majority of my life. Almost 30 years I've been lifting weights, give or take. I'm not sure what caused my hernia. It might have been exercise. It might have been weightlifting. I did have some sciatica, and I was doing some heavy, not that heavy. I mean, I'm not, again, a power lifter. Wasn't doing more than, I don't think, 100 pounds in a deadlift, which is not that much. But it was more rehabilitation for sciatica, deadlifts, squats, lunges, and bridges, and things like that. Let's call this like 2000, 18 or 19. And so could that have been it? And the pressure, squeezing and stuff like that, maybe. I do remember, and that was probably more so this that I think about it. And somebody actually on YouTube, I think, was talking about it, and was talking about exercise and crunches and really trying to work the core. And I felt a stabbing, poking right there, which makes sense in terms of, well, that's where your stomach is, and your hernia would pop up, kind of a thing. So it might have been that. I'm not sure, but either way, I never had any restrictions in terms of the hernia. Weightlifting, bike riding, other activities, running, sports. I have restrictions because I have bad knees and bad hips and bad ankles and bad shoulders, and my body's a disaster. But if I didn't have all those other musculoskeletal issues, then I would have had no restrictions on doing anything. The hernia didn't stop me from lifting weights or doing anything. And I might have felt pressure, here and there, but it wasn't constant, and I didn't notice it necessarily more when I lifted weights versus when I did something else. But in any case, no restrictions really before. And even once I had the hernia, again, let's call it spring, summer, as I mentioned in my last video, spring, summer 2020. After I was sure I had the hernia, which they confirmed with an endoscopy in fall 2020, I think it was September 2020, I still lifted weights. I still did what I needed to do. Although I did stay away from more specific, like core related types of exercises, but I did do some other stuff. I didn't do a lot of crunches, but I did some, planks and things like that, where you're, in a push-up stance, if you don't know what that is, and push-up stance, or, on your forearms, your elbow area, instead of just your hands. So, different things, and not just holding, but moving your legs and doing it. Runners, I forget the names of terminology of everything, but climbers, anyway, just, you're doing core activation. I was more careful after I had the hernia. I don't want to make this worse, and my main concern with my anxiety is just I'm going to not to freak anybody out, so pause, or move forward about 30 seconds, and I'll stop talking about it, hopefully. But, didn't want to make it worse and have strangulation or something and have to be rushed to the hospital, that kind of stuff. So, anyway, back to what I was talking about, without any of you that have skipped over that part. Not that I didn't show anything. It was just again, a mention of it, but I know I have anxiety, so it makes it worse. In any case, I was careful about core engagement, and I didn't do anything heavy, extremely heavy, what I'd say a bodybuilder would be after, but I was still able to lift weights, and get stronger and leaner and or bigger, depending on what my goals were at the time. But again, I'm not a serious bodybuilder. I don't eat like a bodybuilder, and I don't look like a bodybuilder. I just like to do resistance training. I just do. I like to just maintain strength and be able to do as many everyday activities as I can. So that's why I do it, and I just enjoy it. It's euphoric to me. So I just thought I'd move into a different place. So very careful after the hernia, and then essentially after I had the hernia surgery, July 21st, or is it the 20th, 2021. Of course, I didn't lift any weights. I followed restrictions for 6 weeks, and I think I waited 8 to 9 weeks before I did anything, really lifting anything, even the trash. I didn't lift the trash out of the trash bag, out of the trash can, excuse me. My wife helped. She was wonderful. Taking the trash to the curb. I mean, it's not just lifting, but pushing and pulling. Any core engagement. You know, if you have tiki torches and you're trying to push those into the ground, you're going to engage your core. If you don't believe me, try it. And I'd be shocked if you said, I didn't feel it in my stomach at all. Good luck. So it's amazing what some of the things you do and you don't realize you're engaging your core. But after I recovered, it was at, week 8, week 9, something like that, maybe even week 10. I don't remember. Post-surgery, I started, doing resistance training again. And I was able to, again, I put on I was at the lowest I was at was 140 pounds, and I got up to 160. And right now I think I'm at about 165. So I put on, 25 pounds. It's not a lot of muscle mass. I mean, I was really, really lean and skinny. Lost a ton of muscle mass and a lot of weight over that course of time. So I was able to put on the weight that I'm used to. I'm, about 5'8", 165. I'm not a huge guy, but that's, where I'm more comfortable, between 155 and 165, give or take. I really don't want to get over 165, but, I probably could stand to lose a few and lean down a little bit now, but I'd like to be a little bit bigger. But I also worry about how that affects my stomach, and it doesn't put more pressure just being a little bit bigger. Otherwise it's not really a problem. I haven't had too many problems. And otherwise, again, I'm extremely careful. I don't do really core work. I don't do crunches. I don't do that kind of stuff. I wouldn't be afraid to do a plank, on the forearms. I wouldn't be afraid to do that kind of stuff, but any really strong core engagement, I'm not going to do that. So if that affected my lifestyle, somebody asked about that, but I didn't do that before. So really, I guess I did some here and there, but I wouldn't do that. I don't think I wouldn't do some of the exercises that you might see on a home workout program or in the gym. I'm just not going to do that kind of core engagement. I might just do kind of planks, or it might be a simple thing where I'm on, and I guess I could show where I'm doing this kind of a thing on the floor and bringing the knees up, that kind of thing. Sorry, my concussion still bothers me, and moving around makes me dizzy sometimes. But otherwise, I'm not going to do any intense core exercises. I'm not going to risk that at all, not even close. I'm not going to do a traditional sit-up. I'm not going to do that kind of stuff. So I refuse. I will just not, unless I have no other choice and a bear is chasing me, then I'll do it. But otherwise, I'm not doing it. It's just not worth the risk for me. So other things, I'm careful. I feel like I can do most anything that you wouldn't want to do, like a 42-year-old person would be able to do. In and out of the car, getting groceries, carrying groceries in from the car, you name it, doing home improvement projects, even if it was carrying like a heavy saw. But I am careful if it gets heavy. For example, if it was moving into a new house and you had to move your heavy dresser like this that's behind me, I don't think I'd do that. I think I'd have somebody help me do that, and I just wouldn't do that. I do the little stuff. I'm not going to lift something that's extremely heavy. I'm just not going to do that. In addition to the hernia, my other musculoskeletal issues will stop me, and I just know I can't physically do that. So I'm 42 and I'm in decent shape, but yet there's certain things I'm just not going to do. I'm not going to risk it. So could I? Probably could do it, but I just am not going to risk it. And I haven't had to do those types of things. So if you have and I don't have a physically demanding job, I sit and do computer work a lot of the day, and I'm not having to carry or lift a lot of heavy equipment. So just if you have a job like that, or you work in construction or something like that, it might be a challenge for you. But again, I just haven't had. I'm trying to think of other examples of things that you might do and jobs that you might have that would bother you. If you were a nurse and you were having to deal with patient care and lift someone, I mean, that would be a tough one. I wouldn't do it. I'd be scared. So I'd find a new, and not that it's that easy, not implying that it is to find a new job, but I guess if I was a nurse, I'm like, man, I have to find a new profession. I just can't do this. It's just going to be too physically demanding on me. I just want to deal with re-herniating or causing other damage. It's not worth it. So, other things in terms of lifestyle, again, I can't think of things I just can't do or won't do. But again, I take it easy. The most physically demanding things I do are resistance training things, but I don't have to lift heavy furniture. I don't have to clean toilets like a janitor, or lift heavy linens like a housekeeper, or lift heavy patients like a nurse, or construction work. I just don't have to do that stuff. So I'm lucky in the job that I have, where I'm on the computer a lot, and then meeting with people, doing teaching and training and stuff like that. So I don't have to do that stuff. So beyond that, I don't know what else to say in terms of lifestyle and things like that, and exercise. But again, I haven't played basketball, and I like basketball. I would imagine you probably could just fine. The things that you want to be mindful of, I suppose I should say this, is I have only laid on my stomach maybe twice since the surgery, and I won't do it again. That bothers me. And I did see a YouTube video, you could probably find it. Somebody talked about having the TIF and going surfing too early, if I recall, and it popping the TIF open. But I'm way past, it's too soon. Now, I mean, it's again been a year. I don't remember what she said, and if it was a week or a month or 2 months, but I didn't do anything. But now, even now, I mean, I go to physical therapy for treatment on my neck, and it bothered me. It almost caused symptoms, and I don't know why, but it did. So, and ever since, I've kind of come out of that, and I don't have symptoms anymore. But it lasted a couple days. It was weird. I don't understand why. But I'm not laying on a massage table, so I'm not going to get a massage ever again. I will not, unless it's in one of those upright tables, not flat, but the ones you might see at the mall, where you're kind of sitting upright, more so in the chair, and your face is, more so like you're leaning like this forward, and you're like hugging this chair kind of thing. I'm not going to get on a massage table. I'm not going to have a doctor. The doctor's going to have to check me when I'm standing up. I haven't had to have the doctor check my low back when I'm lying on my stomach. But they're just not going to do that unless I'm under anesthesia, or again, I have no choice but to save a life. I'm not getting on my stomach. So just not going to do it. It just bothers me too much for whatever reason. And it happened even beforehand too. I went to have a massage before my surgery, and it caused a symptom flare up, and I don't know why, but other than the pressure on the stomach, and it caused that to flare up. But that's the only other thing I can think of. I'm not getting on my stomach. I could get on my stomach on the floor if I had to, just for a second, but I'm not going to lay there for a period of time. I'm not going to get a massage, like I said, or lay on the doctor's table unless I have no other option. I even asked my PT recently, because I just recently had dry needling, find me another method to get the treatment that I need without lying on my stomach. I'm just not doing it. So I think that's it. So hopefully that helps. I'll make another video if I can think of another topic. But again, I'm doing pretty well. I can do a lot of things. I feel normal, and normal for my age. Again, I'm not old. I'm not real young. I'm not in my 20s and I can't do everything I want. But again, who can? When you get older, you just can't do some of those things that you used to when you're in your 20s. So hopefully that helps. Again, if there's questions, let me know. Other ideas for videos too, and I'll do what I can.